Welcome back to Breakfast Television. 1 in 4 households in Canada have someone affected by migraine headaches, something we're very familiar with here in Calgary. But is that head pain really a migraine, or is it simply a headache? Dr. Elizabeth Leroux from the Department of Clinical Neurosciences at the University of Calgary is here now to help us understand the difference, and she brought along chronic migraine sufferer Leah Kazmarek. Good morning to you both. Thank you so much for being here.
Thanks for having us.
Dr. Leroux, let's start with you. First of all, how common are migraines?
Extremely common. So migraine is the third most common disorder in the whole world. The first one being dental caries, right? The second one being tension type headache. So headaches are extremely common. Migraines affect 15% of the Canadian population. So that's a lot of people.
Absolutely.
Yeah.
And these symptoms can be really debilitating, can't they?
They can be. So migraine is a spectrum. So what confounds people is that all migraines are not the same. Far from it. So what's the difference between a headache and a migraine? Okay. So a headache is a little headache, tension in the head and the neck, but no other symptoms. Migraine is more than a headache because it's accompanied by other symptoms like nausea, vomiting, sometimes auras, which are neurological phenomena, and hypersensitivity to light, sound, smells, neck pain, dizziness. So a big mix and match of neurological symptoms that can just stop you in your tracks and put you in a dark room, and then whatever you had to do that day is gone.
Is gone.
Highly invalidating for some people.
Absolutely. And how does chronic migraine play into that?
So chronic migraine is when you have a headache or a migraine more than 15 days per month. So I don't know if you can imagine.
That's half the time.
That's half of your life,
yeah,
or more. So I have patients, I ask them, do you have headache-free days? They don't even remember what being headache-free means. So chronic migraine is 1% of the population, highly disabling, and also has an impact on work, on family life. So that's the severe end of the migraine spectrum. Very common. Very common.
Leah, is this ringing true with you?
Yeah, that's exactly what I've been suffering from for a long time. The symptoms get so debilitating. Like, I can't stay at work. There's my auras warn me that a headache's coming on, and if I've had enough headaches in a week, I have a coexisting condition where it'll go to what's called a pseudo seizure, and if I stay at work through the migraine, then I'll have that seizure at work, so I would have to leave. Wow. And it was happening often enough at many of my jobs that I wouldn't be able to maintain a job because employers just couldn't rely on me enough.
Right. Wow. Huge quality of life implications here with migraine.
Yep.
Wow.
Yep.
So what can we do for these people, Dr. Leroux?
So the first thing is to know that there are not enough headache specialists and enough training for family practitioners for migraine in Canada. So I hear a lot of stories. You're the first one that gets me, that understands me. And I don't think that's because I'm better. I think it's because I've been trained.
Right.
So we need more education. So what do we do? First, I think going online can be a good idea. It's not always good to go to Dr. Google,
right,
but sometimes it's good. So you can go to the American Migraine Foundation, can go to migrainecanada.org. Mm-hmm. You can join the Facebook Migraine Calgary Warriors.
There's a local Facebook group.
That's
okay,
a private support group where patients can exchange tips, and I actually do monitor it, so it's a great thing. And then if you have chronic migraine, you can go to mychronicmigraine.ca, where you can find resources and also some access to Botox injectors, which is important.
Okay, and so we were seeing this website up now, and this is just one of many tools online that are out there to give people the information they need to have that informed discussion with their healthcare providers.
Absolutely,
right?
Because treatments are very complex. I told you before that migraine symptoms can be very variable. Like Leah has auras, she has also motor auras, complex auras. Not everyone has them. Mm-hmm. So you have to adapt to the specific case, to the specific person, which treatments could be appropriate. And your doctor will have to choose for you an acute treatment to break the attack and a preventive treatment to prevent the attacks, and also lifestyle modifications. Sure. So you put your brain in the right place. And I think, so you've tried quite a bit of treatments.
Oh,
right?
goodness.
And Leah, you've actually had some great success, eventually.
Eventually, yeah. And that's one of the things is when you talk about there's not very many headache specialists out there, it's true. And so the great success that I've had is because of the persistence that I've had. I've dealt with people who weren't headache specialists that I would go in and say, I've got these headaches, and they'd be like, oh, they're just headaches, go take a couple of Advils. Well, there was something called rebound headaches, that I was having so many headaches, I would be taking Advil 4 times a week, and then I would get headaches because I was trying to take Advil all the time. And so actually
But in the end, you found
in the end, I did actually work through getting through the specialist, getting to people that actually did know what they were doing, and then persisting through that. And when we tried things, then the specialists that did know what they were doing, they would say, okay, that didn't quite work, but that's okay. Let's try this other thing. And it was that support of, yes, we can try something different. And rather than just saying, okay, that didn't work, we don't know what to do.
Right. So what you're saying is if you can get your hands on the right specialist, there is hope out there.
There is very much. And that's probably the biggest message that I would send to people, that there is hope and be persistent.
And be persistent. Thank you both so much for being here.
Thank you for having us.
This is fantastic information for all of those migraine sufferers here in Calgary.
There's hope out there.
Lots of them.